Dr. DeBeer here at Axon Integrative Health. I'm here to chat about CRPS today, chronic regional pain syndrome, what that is, how it can be treated, kind of the process of healing, things you can be doing at home, and what a return to activity might look like. CRPS, chronic regional pain syndrome, or RSD is what it's previously been called, or reflex sympathetic dystrophy. These are complex pain syndromes that originate from damaged tissue, whether a broken bone or a tendon rupture or surgery or something along those lines, that just ends up not sitting right with your nervous system, if you will. And I know that's kind of an oversimplification of this, but what's happening is there's a brain change in that what's called a homunculus map, or our body's representation within our brain. It's a pretty precise topographical map within our brain and our sensory motor systems and our areas. These sensory motor systems and our pain modulating systems aren't communicating very well. So after time, let's say we broke our ankle and now we're starting to get this chronic pain 3, 4, 5 months after that initial injury. We've gone through PT, the chiro, all the things to help heal the injury itself, and it's healed. And on x-rays or MRIs and everything like that, there's no damaged tissue. There might be some edema or swelling, some temperature dysregulation, which is all part of the CRPS complex. When we have this injury and this pain syndrome, I feel like a lot of people nowadays know what neuroplasticity is, or the brain's ability to change based on the environment and the situation at hand and repetitive exposures to things. Neuroplasticity is usually regarded as a positive thing for change. With that being said, it can happen in the negative way of change as well, right? What fires together, wires together. And if at time after time we have damaged ankle and we're firing that over and over again with movement and pain, then movement and pain now get wired together. And soon enough, when we don't have what's called nociception, or pain in the area getting signaled to the brain due to damaged tissue and the need to protect that area, this is nociceptive pain. This is what should be happening. You prick your finger, you roll your ankle, you break a bone. This nociceptive pain signals to the brain that, hey, there's something going on down here. There's damaged tissue and we need to protect it. And that's what pain really is. It's a protective mechanism. However, when it happens for too long and the injury itself is healed, the broken bone, the tendon, whatever it is healed, but the pain continues, is when it becomes chronic pain. And after a period of time, when it becomes an intense amount of pain and it starts applying other things into a sympathetic or a parasympathetic nervous system and autonomic changes, is when we start considering it a CRPS and having these issues with a brain-body connection, right? It's really a part of how the brain is able to send or receive these signals of pain. And like I said, when we start wiring these things together, we create what's called neuroplastic pain, or it's this sense of neuroplasticity now rewiring movement and pain together. And every time you now move that ankle, it triggers pain. And this can be extremely debilitating to patients and their lifestyles and what they do and activities and mood regulation. It could lead into anxiety and depression and even hormonal dysregulation. It's not a great system to have, right? But a lot of the times when we start looking into this process, traditional medicine will start trying to treat the area that's in pain, and that's not really how we should be trying to treat CRPS. CRPS is treated through brain training, brain activity. It's a brain issue, right? And I know people have probably heard, if you've been in this journey, you've heard it's in your head. Unfortunately, the way they say that makes it seem negative in connotation, but everything in our environment happens within our head. Everything in our body, in our sensorium, happens within our brain, which is in our head. kind of chuckle when you hear that, right? You don't take that as a negative thing, right? And I know whoever is trying to gaslight or downplay what your situation is, but in reality, it really is. It's a brain issue. And your brain's not able to disconnect these wires or allow the pain modulating systems within the brain to have down regulating or descending inhibition of this pain, right? So treating CRPS really requires, and it's extremely paramount, to address the brain and the neurology at the same exact time. So we need to train the brain in how it modulates pain, how it sees the body, as well as retraining movement and moving the body. What wires together fires together. We can't just train the brain either, right? We need to train the movement with it so that the brain and the movement together, and we can heal together and see these return to activities and get back to the things that you want to be doing and things that bring you joy. Things that we offer at the clinic and other things that might be beneficial for you at other clinics and around wherever you are, what might be helpful for CRPS. Look for somebody who is trained in functional neurology or in CRPS directly and treating CRPS or F&D or things along those lines. Therapies themselves can range from neurofeedback therapy, neuromodulation like TMS or TDCS. We can look towards things like class 4 laser or acupuncture or PEMF, coupled with hyperbaric oxygen and sensory motor integration, neural rhythm timing, interactive metronome, vestibular training, eye movement therapies, electrical stimulation, functional movements, vibration. All of these things are clinical therapies that could be beneficial and be helpful for a lot of individuals with CRPS in helping train the brain and the body to reconnect and be in a healthy state. That's all to say that the things that you can be doing at home need to be happening at the same time. The importance of nutrition, sleep hygiene, exercise, self-talk are the most paramount in your recovery for CRPS. Everything that we might do at the clinic or at any clinic that you might go to needs your dedication to sleep and nutrition and self-talk as the foundation of everything else that we would build upon. That, what we do, is the top of the pyramid. What you do is the foundation and the base. So making sure that we're eating an anti-inflammatory diet, we're staying low on gluten, we're staying low on added sugars, we're staying low on dairy, and we're really making these whole foods and fueling our brain and our body. Things like high protein, really good veggies and micronutrients and fruits, making sure that we're getting good starches in and not these simple carbohydrates, making sure that we're having snacks and feeding our body throughout the day in a healthy way instead of binge eating on not so great foods. Good hydration, good salt intake, electrolyte status, all of these things play a really big part. Making sure we're telling ourselves that, hey, this is a brain issue. Let me manage my anxiety. Let me manage my stress. Let me do some breath work and go for a walk or do some meditation or do a yoga flow with breath work. All of these things are going to be paramount in your healing journey. Making sure that we're seeing the sunrise and the sunset and establishing proper circadian rhythm. Making sure that we are doing things to help calm our nervous system before we get into bed, before we even think about going to bed, right? Turning the lights down a couple hours before bed, no screens an hour before bed, no heavy meals a couple hours before bed, right? These things are going to really help us get deep restorative sleep so the brain and the body can help reconnect again. These are these things that you can be doing at home right now, free of charge, before having to go see other people and start tearing down these avenues, right? Get all of your at-home work built into your habits and your daily dedications, and then start looking for people with CRPS backgrounds and abilities to help you heal, and some of these therapies that might be beneficial for you if you need to be the own quarterback of your healthcare and kind of piece together a few of these things because one clinic doesn't offer all of that. By all means, piece some of these things together. Don't try to rely on one simple thing to help you either. If you've tried acupuncture in the past and it didn't work, maybe try acupuncture with laser therapy with neurofeedback and making sure that all of your at-home stuff is getting done. There's not going to be one thing that fixes us, and unfortunately that's not the way it works. However, we are building a recipe for your cake, if you will. I enjoy this analogy and I tell this to a lot of my patients, but just because you put flour in the oven doesn't mean that flour is not important for the cake the next time you try to bake it. Right? Just because acupuncture or neurofeedback alone didn't work for you last time doesn't mean that if you combine that with a few other things or your own at-home dedication, that you would see a much different response to how that therapy is affecting your nervous system and your brain-body connection and your CRPS and your chronic pain. It's a recipe. Don't discount one thing because it didn't work last time and that was the only thing you were doing at that time. The process is long. The process is difficult, but it is simple. It's not easy, but it's a simple process, right? We need to be able to tell ourselves, hey, this tissue, my foot, my hand is healed. There is no damaged tissue. This is a brain-body connection, and I am working to disconnect the pain and the movement being wired together. I am working to regulate my nervous system, and I am working to decrease and inhibit the pain that I'm experiencing. Right? You don't have CRPS. You experience CRPS. You don't get to claim ownership over it. It's a whole lot harder to get rid of an ownership than it is to get rid of an experience, right? These are some of the ways that we can start talking to ourselves as we go through this process. Like I said, it's going to take a lot of effort. It's going to take a lot of dedication, but it's a simple process. The steps are very simple. We need to train the brain. We need to have good at-home hygiene and self-talk and just at-home care. We need to find somebody who is dedicated and knows CRPS truly. There are clinics out there that claim they treat CRPS, but they see these patients for months on end, and it's extremely expensive, and you go through a lot of pain. If you're going through pain or increased sensations of pain without a decrease immediately following, your CRPS treatment is not doing it for you. We do not need to be increasing pain by any means. If anything, it should be maybe a blip and an immediate decrease, not a large increase in pain. And if that is causing you pain and you're letting your provider know, then that provider is not for you either. You need to find somebody who knows about CRPS and knows how to stimulate the nervous system without driving more pain. And by the end of the session, if you're feeling a little sore or a little worked up, that's okay. By the end of the evening, you should be feeling better. You might have a flare the next day. The third day, you should be feeling better. If that's not happening, that's a problem, and your treatment plan needs to be revised and revisited. Your return to activity, again, that's a long process as well, right? Once you start doing the things that you love, it's going to take time to get back to those things fully. Don't be discouraged. If you're a skier and you have CRPS in your foot and it hurts the first time you go skiing in 2 years, that's okay. Again, tell yourself there's nothing wrong with my ankle. There's nothing wrong with my foot, right? This is my brain. I'm going to have fun. I'm going to release dopamine, and it's going to be a great time, right? It might piss it off, but that's okay. I'm working through this process, right? Returning to activity and finding the joy in life is going to exponentially improve your symptoms and decrease your pain. Better than anything else will. You need to get back to it, right? Once you're 80, 90% there from therapies and what you're doing at home and your dedication to your care, that return to activity is the last 10%. We need to start doing these things to heal the rest of the way. Right? This is the excitement to get back on the ski hill, right? Or maybe play pickleball or tennis again if you have CRPS in your hands, or maybe pick up your grandkids, or hold your significant other or your spouse. These are things that are going to really bring you the rest of the way home, if you will, or healed, if you will. CRPS is not a condition that is lifelong. It is a concern that has an end date. Find the people that will help you. Do the things diligently at home and trust yourself. And really drive positive self-talk in what you're doing and how impressed you are with yourself and how hopeful you are for the future. Doing these things, you will set an end date to your CRPS and you will not be in chronic pain anymore. I know it's hard to believe and I know it's super emotional. Do these things and you will be healed. If you want any help with CRPS or any guidance like that, give us a call. I'd be happy to point you in the right direction, or we can have you come into the clinic if you're local. We can set up a plan. If you're out of the state or out of the town, we can set up an intensive plan and kind of a maintenance going forward. So if you just want any help or even finding people in your area, I'd be happy to point you guys in the right direction. Good nutrition, good sleep, good breath work, good exercise. Every single day, it's a non-negotiable. It needs to happen. Good self-talk needs to be happening as often as possible throughout the day. Positive affirmations towards yourself. Have a great rest of your day and happy healing.